Hello, welcome to this week's flashcard presentation on hypertension. Let's discuss what hypertension is. Hypertension is also referred to as high blood pressure, which is a condition where the pressure in your blood vessels is too high. Hypertension is estimated to affect 1.28 billion adults globally aged 30 to 79 and is a leading cause of cardiovascular disease and mortality. On its own, it can sometimes be known as a silent killer because oftentimes it does not cause any symptoms until it is too late. The most affected population by hypertension in the United States is non-Hispanic Black males. So now let's discuss the pathophysiology of hypertension. Hypertension is a sustained arterial blood pressure higher than what is medically normal. Blood pressure is measured in millimeters of mercury and consists of both systolic and diastolic pressures. Systolic pressure represents pressure in the arterial system during contraction of the heart ventricles, which is known as systole. The diastolic pressure is the pressure in the arteries during relaxation of the heart, referred to as diastole. Blood pressure is referred to by using the systolic number on top and the diastolic number on the bottom. It's generally read as 120/80, and that is typically a normal range for a blood pressure. Stage 1 hypertension is a systolic reading between 130 and 139 millimeters of mercury, or a diastolic between 80 and 89 millimeters of mercury. Stage 2 hypertension is when the blood pressure is consistently greater than 140/90. And when blood pressures reach 180 to 120 or greater, this is considered a hypertensive emergency and or crisis, according to the American Heart Association. There are two classes of hypertension, being primary hypertension or secondary hypertension. Most hypertension cases are classified under the primary category. And this happens when the sympathetic nervous system, which is part of the autonomic nervous system, is being activated, which is also known as the fight or flight response. When the sympathetic nervous system is activated, this increases the heart rate, which constricts the blood vessels, causing an increase in blood pressure. The sympathetic nervous system also affects renin secretion and sodium retention, increasing the blood volume, therefore increasing the blood pressure, leading to hypertension. The renin-angiotensin-aldosterone system also contributes to hypertension. The hormone renin is secreted by kidneys, and when the RAS system is activated, aldosterone will be released from the adrenal glands, and this causes sodium retention, vasoconstriction, and on a systematic level, and also insulin resistance, which will all lead to hypertension. Some risk factors of hypertension include increased sodium intake because this promotes fluid retention, and when blood volume increases by sodium and water retention, blood pressure will then increase. Other risk factors include obesity, a familial history of hypertension, race, reduction in nephrons based on damage to the kidneys, increased alcohol consumption, not getting enough exercise or sleep, and a low socioeconomic status also places people at risk because they don't have access to health insurance and therefore they're not getting the proper screenings that they need to prevent hypertension. And lastly, being pregnant can also put a woman at risk of developing gestational hypertension. Signs of hypertension include an elevated blood pressure of greater than 120/80. And when it becomes greater than 180/120, that is considered a hypertensive crisis. Also, patients will have flushing of the face because the blood vessels in the face are dilated due to the forceful nature of the arterial pressure. Sometimes you can see subconjunctival hemorrhage based on the damaged blood vessels leaking into the retina. Also, patients with high blood pressure can suffer heart attacks because there is damage or weakened blood vessels of the heart, and same thing goes for stroke. There are signs of damaged or weakened blood vessels in the brain due to the hypertension that has been consistently ongoing without being treated. Symptoms include mild headaches, which are common and can be severe and sudden, which are a cause of a hypertensive crisis. This is when the blood vessels will be narrowed and constricted, and this increases the pressure in the brain, leading to headaches. Severe headaches are a symptom of the hypertensive crisis because when the blood pressure is elevated to a dangerous level, blood vessels in the brain tissue under the skull are constricted, which will place excessive pressure on the brain, causing blood to leak from the damaged vessel. Chest pain is a symptom of hypertension causing a narrowing of the arteries and blood vessels in the organ. which then creates a sensation of pain or pressure. Nausea and vomiting can be symptoms as well because the high blood pressure in the brain can stimulate the part of the brain on the brainstem that causes that sensation of nausea and or vomiting. Vision changes can be common based on damage to the blood vessels in the eye. Anxiety can also be present based on elicited by a secondary response to that feeling of chest pain or pressure or whatever sensation the person is feeling based on the high blood pressure. There can also be nosebleeds that are a common symptom based on the forceful pressure in the blood vessels. Buzzing in the ear is also a symptom based on the high blood pressure flow through the artery within the hypertensive crisis. Arrhythmias can be seen based on damaged blood vessels in the heart. And lastly, confusion can be based on a weakened blood vessel in the body that is leading to a lack of oxygen to the organ. So blood pressure is measured using a blood pressure cuff, usually over the brachial artery. And this allows the provider to determine what the systolic and diastolic measurements are and determine if the patient has hypertension. Labs include a blood chemistry, including electrolytes, glucose, creatinine, glomerular filtration rates, lipid panels, and urinalysis. The test will detect underlying causes of hypertension, and also a urinalysis can detect if there's kidney or liver damage based on the extensive nature of the hypertension. An echocardiogram, which is a picture of the heart, can test to see if there's any damage to the organ based on the high blood pressure. And a kidney ultrasound can be performed to determine if kidney damage is responsible for hypertension. Treatment for hypertension includes adjusting modifiable risk factors, such as stopping smoking, exercising regularly, and maintaining a healthy diet and a healthy weight. And also, when hypertension is diagnosed and it's unable to be treated based on changing modifiable risk factors, usually antihypertensive medications will be prescribed, and generally 1, 2, or 3 medications will be used at the same time. And if those medications seem to be ineffective at treating the hypertension, then it is generally known to be hypertensive caused in the secondary nature, and it's probably based on kidney damage and not just a primary hypertension diagnosis. Thank you for listening, and here's a list of attached references. Thank you.